Hi, I'm Dr. Sunil Kumar K, lead and a senior consultant, interventional pulmonologist and a lung transplant physician at Aster CMI Hospital, Bangalore. Today, the topic for discussion lung transplant. It is a reality in India for end stage lung diseases. Now, these are all the options which is considered for adults with advanced lung disease. To be more technically, person who has a high risk of mortality to the tune of 50% in the next 2 years if lung transplant is not offered. If I do a transplant, I should be successful to the tune of more than 80%. I should be in a position to survive this person for more than 90 days. What are the diseases condition which can be benefited by this lung transplant? Interstitial lung disease, when which a burnt out disease like idiopathic pulmonary fibrosis. Of late, we are seeing a CTD or a current issue disorder, ILD, more so in the younger population. Depending on oxygenation and the quality of life, we offer them for this particular lung transplant. Bronchiectasis, pulmonary hypertension, and a severe burnt out COPD. Now, when these patients with ILD or somebody who is on oxygen, somebody with a compromised quality of life comes to you as a transplant surgeon or transplant team, we should be comfortable with in terms of thoroughly evaluating the historical aspects. And of late, I think the COVID has given us a sort of an opportunity where the patients do develop this sort of oxygenation dependency, and at the same time, the oxygen requirement going up qualifies to call that can we offer this particular patient something else with a new lease of fresh pair of lungs which can make a difference. To understand this, we need to understand what is transplant window. Any patient with a rapid progressive disease, increase in oxygen dependency, recurrent hospitalization, contributing for a poor quality of life qualifies to offer this lung transplant which can address all these issues in a minute way. Now, there is always an apprehension from the medical fraternity in terms of how this functionality, where I think we have a legal cover in terms of government body coming up as a good hand-holding process actually, where a structured a program has been articulated starting from a NOTO, where Directorate General of Health Secretary taking care of a NOTO, nothing but National Organ and Tissue Transplant Organization, situated in Safdarjung Hospital, New Delhi. Divided into regional ROTO, divided into state-wise, where Jiva Sarthakate, this is contributed from Government of Karnataka to oversee the transplant activities and at the same time providing a good amount of awareness across the public domain. Now, when you're going through all these things, initially you consult a transplant physician who will evaluate your condition, whether are you going to be benefited with this sort of a transplant. No doubt transplant has a pros and cons where that has to be clearly understood before subjecting you for a transplant. And once the transplant surgeon feels this patient can be transplanted, we go with the evaluation process where multiple blood tests, multiple tests to assess your overall capability to cope up with the post-op. We go with the evaluation process. It can go for 3 to 4 days of hospitalization with multiple number of tests. After test results, we're going to have this sort of a discussion with a multidisciplinary discussion with a surgeon, anesthesia, rehab, and nutritionist. Based on multiple parameters, can we optimize your condition? And if so, if we do that, can we list you to the waiting list, which is headed by Jiva Sarthakate in the state of Karnataka. Once the wait list has been there, they have a database in terms of matching your donor, height, blood group, which are the two things which is crucial for making a decision about the matching for your transplant. Now, the transplant surgery, it can take up 6 to 8 hours in the case of a bilateral lung transplant, as compared to heart and lung transplant constitute for 4 to 6 hours. Now, once we have done this particular surgery, the main thing is the complexity is quite vast. It is one of the most complicated surgery known in a surgical domain, where 3 more anastomosis is what is noted actually. Airway anastomosis, pulmonary artery and pulmonary venous anastomosis. During the process of anastomosis, put a patient on a bypass or a central ECMO. Having said that, this complex nature needs a good amount of care in the ICU setup with a good amount of gizmos to monitor the hemodynamics and also tight rope initiation of immunosuppression and infection control with a good amount of antibiotics. Now, to comprehensively address all these things, we have a good number of team members, including a surgeon, transplant physician, your intensivist, anesthetist, ID or infectious disease coordinators for all this articulating in terms of donor optimization, donor calls, including the whole process of financial thing also which has to be dissected. Your dietitian, physiotherapist, psychologist. Now it gives me a proud privilege to announce we at Aster CMI provide this sort of a complex lung transplant care in a comprehensive way with a multidisciplinary team which is dedicated starting from a surgeon to the level of psychologist also to give this success thing in a field of transplant in Karnataka. Thank you.